Today we're speaking about obstetric history, how to take obstetric history. Sure, obstetric history, one of the peculiar history related to obstetric and gynecology, and not taking in any department other than obstetric and gynecology. What is the item? First, we should know number of previous pregnancy. We ask the patient how many times get pregnant before. Just number of previous pregnancy. If the patient pregnant now, it shouldn't include current pregnancy in this item. Followed by number of previous delivery. Just number of previous delivery and delivery after 28 week. Just delivery, not abortion. We should mention is it normal or abnormal. It is very important item. What is the criteria of normal labor? Not all vaginal delivery is a normal delivery, but all normal delivery should be vaginal and should not confuse between normal and vaginal delivery. The patient even delivered vaginally, even at home, the labor may be abnormal. So to fulfill normal criteria, we should have 10 items. First, 5 of them single word. First, spontaneous onset of the labor. The patient should not take induction of labor. The patient, when said to us that they reach post-date or post-term and there is no labor pain and go to doctor and give induction, it's regarded abnormal labor. But if they receive augmentation, spontaneous labor come and she receive just augmentation to increase labor pain, still normal labor. Second important item, single. If the delivery to twin or triplet, it's not regarded normal labor. Third item should be living, whether that is care before delivery or intrapartum this delivery of the dead fetus should be regarded abnormal labor. The fourth item is term. Term means that the pregnancy exceeds 37 weeks and less than 48 weeks. We all know how to calculate pregnancy from the last menstrual period. We add 7 days and 9 months to calculate expected date of delivery, which equal to 40 weeks. The fifth item, the fourth fifth item is vertex. Returning to the fourth item, term, if it's less than 37 weeks, which is regarded preterm labor and regarded abnormal labor. The patient said to us that it's delivered in a 7 or 8 months. Patient may not know the weeks of pregnancy, but she in months that delivered in 7 or 8 months. Fifth item is vertex or cephalic. The patient should say to us that deliver vaginally and cephalic presentation. She may not the item vertex, but if said to us that the delivery through the face presentation, it should regard it abnormal labor. If said to us that delivered breech, it should regard it abnormal labor, even vaginally. The following 5 items, not single word through short sentences. 6 items through birth canal, sure, should be vaginally. The 7 items within 24 hours, beginning of onset of labor till the end of the labor, followed by with no or minimal intervention. If the patient exposed to ventouse or forceps, it regarded abnormal labor, but episiotomy is still normal labor. Minimal intervention include episiotomy, include augmentation of labor, with no complication to the mother or fetus. If there is any complication like postpartum hemorrhage, but instead intervention like transfer to hospital, taking blood, the patient may say to us that there is bleeding, minimal bleeding, acceptable after delivery or mild bleeding, or the fetus like fracture clavicle, herpes palsy. And lastly, with smooth puerperia, there is no history of puerperal sepsis. All these criteria, if fulfilled, the patient should said that delivered normal. In all delivery, if all delivery were normal, we say all 5 delivery or 4 delivery were normal or 2 delivery were normal. If there is any abnormality in one, we say all of them were normal except the second or third, which was preterm, which was breech, which was a twin, which ended in a dead fetus. like this. If there is all of them are abnormal, we can classify them. First delivery was, and discuss. Second was, third was, like this. If the delivery through cesarean section or by cesarean section, we should mention the indication of cesarean section, the place where cesarean section was done. The only operation mentioned in obstetric history and not mentioned in past history is cesarean section. Returning to main our item, number of previous pregnancy, number of previous delivery, and we know where to differentiate from normal or abnormal labor, followed by number of previous abortion. Before 28-week gestation recorded abortion. We should mention where is first trimester, for 14-week or second trimester, ended spontaneously or by evacuation, and followed by last delivery and last abortion. Lastly, number of living children, and mention one gender of the children. For example, say 4 living, 2 male, or 5 living, 1 female, like this. Thanks a lot.